frequently relapsing nephrotic syndrome. So she presented with fever, cough, and cold for 7 days and generalized edema for 3 days. Urine routine showed 3 plus albumin, 5 to 6 RBCs, and 10 to 12 pus cells. So thinking that she might be suffering from an urinary tract infection, thinking at the pus cells, culture was sent, and the urine culture found out to be 50,000 colony forming unit per ml. So the physician who sent the urine culture, he thought that the child was already started on antibiotics because of UTI, and this colony count could be significant, and he labeled it as urinary tract infection. The renal function was normal, and the ultrasound, the kidney ultrasound also was absolutely normal. So the child was diagnosed to be having UTI and was treated with IV antibiotics for 7 days. And thinking it is an episode of UTI. For further plan of UTI, as a part of UTI workup, MCUG was planned. So I want to highlight in this case is that the presence of pus cells in urine is not abnormal in nephrotic syndrome. Only leukocyturia is normally found in nephrotic syndrome as a part of some kind of inflammation. So 10 to 12 WBCs, or maybe up to 20, or maybe up to 50 WBCs without any symptoms of urinary tract infection is normal. If there is symptoms of urinary tract infection, like fever, like burning micturition, then you should think of UTI. And also I want to like to emphasize that urinary tract infection is a not common infection in nephrotic syndrome patient. So presence of pus cells doesn't suggest UTI. UTI also is not a common secondary infection in nephrotic syndrome patients. More so, UTI doesn't lead to a relapse. So when the child presents with a relapse and you find 10 to 12 WBCs in the urine, please don't diagnose as UTI and start unnecessary antibiotics, because you know the antibiotic resistance is a major complication that we are facing nowadays.